All right. Excuse- All right. Good afternoon, everyone. I hope you can hear me. Um, my name is Kenneth from Trauma Care International Foundation. Um, Today we'll be training you on basic first aid and emergency response. Though I'll be sitting here right now, but on the long run, my colleague here in the office will help do the practical section. We have our mannequins and everything set down to help put it through on what to do and how to, respond to this to an emergency. All right. So first of all, like I said, I'm Ken from Trauma Care International Foundation. So um, my colleague that will be assisting me, her name is Miss Erica. So she'll be assisting me to do the practical demonstration. Though I'll do some demonstration for myself. And before I continue, I'd like to talk to us a bit about Trauma Care International Foundation, about our network, and about what we plan to do and what we plan to achieve on the long run. All right. So Trauma Care International Foundation is actually an NGO with the mission to improve the state of trauma and emergency response services in Nigeria and other member nations. All right. So we are basically all about improving the state of trauma in our country. Most of the time, if an emergency should happen, find out that people don't know what to do. Basically, they'll just be open to taking pictures, making stories, and all of that. But our foundation is uh, does not want that to happen again. Let me use that word. We are trying as much as possible to bridge the gap between emergency response time, all right, in Nigeria and other member nations. So we are actually expanding, not just in Nigeria, we are also expanding to other African countries. Though we have first responders in different African countries, but we are trying to set a network like there to making sure that they have a network that is working there. All right. So basically, Trauma Care International Foundation has set up a network of first responders. So whenever there is an emergency, those first responders will be the one to respond to that emergency. All right, when it be. I'll explain what I mean by that. We have a network of responders in such a way that we have an app and a network that function just like the Uber app. Whenever I need a ride, I just want to give a scenario using the Uber app. When you need a ride, you request, the app automatically assign you to the closest um, rider to come and pick you up. So that is how our app function. Whenever there is an emergency, you request via the Tessera app. The app automatically assign you to the closest first responder that will help manage the emergency. All right. So that is the reason why we're having to do free basic emergency response training, because we want a situation whereby we have first responders in every known location, basically in the state, in different states, cities, local government, both rural and urban communities. We want people that will be able to respond to an emergency, because we don't want to leave this emergency response to just the medical practitioners only, but we want to throw it open to everybody, because our foundation does not want a monopoly system of knowledge. So before I dive into what we'll be discussing today, because we have a lot of interesting topic that we'll be talking about. Basically, if we go out for training, one of the thing we do first is to ask like a pre-test, which I'm going to ask right now because I want the class to be more engaging. So I'm going to ask like 5 questions. All right. Okay, there are five. I'm going to ask 5 questions. If you know the answer, just kindly give them to me. The reason why we're asking this question is because we just want to know your basic knowledge of first aid before the training. Then after the training, we are also going to, okay, if time permits, we'll do a post test for you for us to know how you've learned and all of that, so that we'll know on how to redo this. If it's not, we just want to see the efficiency of this training. All right. So, before I start the training, I would like to ask these 5 questions. If you have the answer, just kindly indicate and give me the answers. All right, you unmute and give the answers. So, number one question is, I hope everybody can hear me. Please, if you can hear me, just kindly indicate so that I know I'm being heard.
Loud and clear.
All right, thank you so very much. So, the number one question is, a casualty has cut his arm and is bleeding severely. How do you treat his injury? So I'm doing you a favor by giving you an option right now. So option one says, okay, let me read the question, then I read the option again. It says, a casualty has cut his arm and is bleeding severely. How do you treat his injury? A says, put the injured limb in some cold water. B says, apply direct pressure over the wound. C says, give him an aspirin. So which is correct? So do we have any answers to the question? Or I should repeat the question again and the option. Do anyone, you can try even if you're not correct, but we can actually correct you if you're not correct about the answers. All right, I think um, Mrs. Mohammed Ramad want to say something. Okay, you can make a contribution. So what is the answer? You can also type it. Maybe you can just type, maybe if it's A, you can just choose A and type it for me to see so that I'll know, okay, you're really following. Do we have answers to the question? Or I should just give the answer and move on? But I think if I should do that, the class will not be more interactive. So I just want it to be engaging. That is why I'm trying to ask this question.
Apply pressure.
Okay. Actually, that is correct. Say apply direct pressure over the one. All right. Okay. Somebody also answered that again. All right. Okay. Thank you so very much for that answer. Okay. So I'm going to move over to the next number two question. So number two question says, on approaching the accident site, you see a man lying on the road by the car. You ask him if he's all right, but he does not respond. What should you do next? I repeat the question again. On approaching the accident site, you see a man lying on the road, hit by a car. You ask him if he is all right, but he does not respond. What should you do next? A says leave him to wake up by himself. B says begin CPR. C says check if his airway is clear. So what is the correct answer?
Check if his airway is clear.
All right, that is correct. Thank you. Okay, number three. Say you need to perform CPR on the casualty who has collapsed and stopped breathing. How many chest compression to rescue breath should you do? If you are to perform chest compression on a casualty who has collapsed and stopped breathing, how many chest compressions to rescue breaths should you do? A says 30 chest compression to 2 breaths. B says 30 compression to 5 breaths. And C says 15 compression to 3 breaths. So which is correct?
I think I'll go for A, which is 30 compressions to rescue breaths.
All right. Are you sure about that?
Yes, I am.
All right. That is actually correct. It's actually correct. 30 chest compression to 2 rescue breath. Okay, number question 4. The recovery position is for a casualty not breathing and unconscious. True or false?
The question again, please.
Can you repeat the question?
All right. The recovery position is for a casualty not breathing and unconscious.
False.
It's not true.
Okay, it's not true. So the answer is false. Okay, that is actually correct. So it's actually false. The recovery position is for casualty not breathing. It's not for a casualty that is not breathing and is and unconscious. Okay, so the last question is, okay, I think I shouldn't ask this last question because it's all about definition. All right. Okay, so now let's go into the training properly. And first of all, before I go into the training, for those that are just joining us, I would like to talk about Trauma Care again a bit. Like I said, Trauma Care International Foundation is actually an NGO based in Lagos with a mission to improve the state of trauma and emergency response services in Nigeria. All right. So basically, we are into, first aid services. We have a network of first responders that help manage an emergency when need be. We are trying to cut the emergency response time whenever there's an emergency. Like I said earlier, whenever there's an emergency, people just go to take pictures and all of that without knowing what to do. So we are trying to bridge that gap so that every one of us know what to do during an emergency. So the question is, what is first aid? Right, first aid, if I should ask, I'll get the definition. Like first aid is the first treatment given to an injured person. All of these definitions are actually correct. All right, but the proper, I just want to point out something to you which is very, very definite, and I think we all need to know about it. First aid is the first and correct treatment. I'll look use the other word, quick and correct treatment given to an injured person. So a treatment that is quick and is not correct, we don't regard it as first aid. And a treatment that is correct but is not quick, it is not first aid. Remember, the first 10 minutes of an emergency is the window opportunity for that person to survive. So you're trying as much as possible to maximize the first 10 minutes of an emergency. All right. So if you're not maximizing that first 10 minutes, the time you take you to transport that casualty from the point of an emergency to the healthcare facility, all right, you spend maybe probably more than that 10 minutes. So the doctors actually do not carry out first aid, they do treatment. But we want first aiders, we want first responders on the streets, everywhere in our localities. Okay, if we have more first responders in our environment, in our communities, when an emergency happens, at least you will help attend to that casualty before moving that person to the emergency facility. All right, so that is all about first aid. All right, so it must be correct and it must be quick. So any treatment that is correct and it is not quick, it is actually not first aid. So I'll be sharing my slide with you so that you know what we'll be discussing about, because basically we'll be teaching you on how to respond to somebody that is unconscious and not breathing, unconscious and breathing, choking, nosebleed, minor cord, asthma, and maybe epilepsy and all of that. Snake bite, we can just talk a bit about it. All right. So, but I'll be sharing my slide now so that everybody can follow. So, I hope everybody can see. Okay, this is about which I've explained earlier that we are an award-winning registered NGO with the mandate to improve the state of trauma care and emergency response services. All right, so we also do blood drive, child safety awareness campaign. All this training is not just for maybe the adult. We also train school children and all of that, even if they don't know what to do during an emergency. But as long as they have the the knowledge of first aid, they can as well teach their parents or instruct them. Okay, mom, I was taught about this is how to go about it, and all of that. Everybody should know about first aid. One thing about children, once they learn, it sticks with them and they can grow up with it. All right, so introduction to TCF topic. Sorry. Okay, so introduction to TCF topic. So we have the TCR app, which I've explained earlier on a bit. We have the voluntary blood donation initiative. We are also involved in voluntary blood donations, and we do this also for free. All right. So we have the child safety awareness campaign and the impact your community campaign. So the learning objective of today's training Okay, so at the end of this training, you should know how to recognize and provide immediate first aid for common emergencies. I'm sorry, I just need to accept this. Okay, at the end of this training, you should know how to recognize and provide immediate first aid for common emergencies. Learn the correct way to evacuate a casualty and know what CPR means and be able to perform it. So, fact to note, I think there are some certain things that I'm going to skip so that I won't waste most of our time. All right. So, simple emergency response plan. You can use the Tessera app to get help, like I just explained. We have maybe at the end of the training, I'm going to explain the app very well for us to understand better. I said do a primary survey, which is DRS ABC. This DRS ABC is very important. Okay, mind you, I'm actually using the American Heart Association curriculum. We have different curriculum, but this is what I'm using. Okay, do a secondary survey, use the first aid kit, call the emergency contact of the casualty. So this is the course outline now. So today we'll be talking about bleeding, nose bleeding, minor and deep cuts, care for an unconscious casualty. I'm going to also discuss about the recovery position, what is CPR, first aid for choking in infants and adults, first aid for seizures and asthmatic attack. All these things has at least a measure, something you can do to help prevent them. Then first aid for burns, first aid for snake bite. All right. So I've defined first aid. I- Okay, so let me just talk about the aims of first aid before going into our topic properly. All right. So one, the aim of first aid, we spell it out, or the indicator is like 5 P's. All right. The first P stands for the aim of first aid is to preserve life. That is what should be with you all the time. That should be what should be maybe on your consciousness all the time. One The number one thing is to preserve life. That is the aim of first aid. And the second thing is to protect the casualty from further harm. Your thoughts should be you're preserving life, you're protecting the casualty from further harm, and you're providing pain relief. Then the fourth one is to prevent the injury or illness from becoming worse, then provide reassurance. All right. If you have this at the back, maybe at your consciousness, you see, you'll be able to attend to an emergency very well. For you to even connect to this training today, that shows that you're prepared to help those in need of an emergency, in need. All right. So first aid kit, I'm going to skip this. Okay, so now let's start this properly. So how to care for an unconscious casualty? I hope you can see my slide. All right. First of all, if somebody is unconscious and the person is breathing, you put the person in a recovery position. And the next one is if somebody is unconscious, I hope you can understand the circle and all of this, because the first part of it is colored green, while the other part is of different color. So I think you should just take a closer look at it. You get the full picture. If the person is unconscious plus breathing, you put the person in a recovery position. If the person is then the other part that we circled, if the person is unconscious and not breathing, you do what we call CPR. All right, so that is the simple thing you need to know during to help somebody in an emergency. Okay, so the primary survey, one of the things you need to know, which is very, very, very important, and everybody needs to know about it. It is called DRS ABC, which is also known as Doctors ABC. Doctors with the letter S. All right. So DRS, the abbreviation of doctors, DRS, then ABC. All right. With this short and simple acronym, you'll be able to help somebody in an emergency. All right. D actually stands for danger or scene safety. R for response. S is send for help. A, airway. B, breathing. And C, circulation. All right. So without wasting much of our time, I think we'd like to do this demonstration immediately, because online last time talked about it before doing the demonstration and I wasted a lot of time. But this time around, I think as I'm talking about it, I'll have somebody to be doing the demonstration for us so that we can see and learn alongside. All right. So like my assistant to come over. So I don't know if you can see from the far view, we have our mannequins there. So she's going to come and mount on those mannequins. The mannequins on the middle is the adult mannequin. We also have another one by the side. We have both. We have adult mannequin, a child mannequin, and an infant mannequin. All right. So an infant is anybody from 1 years downward, while an adult, matured with the rib cage well developed, then the baby mannequin. So okay, they say they cannot see anything. Can you see the mannequin on the ground? Can you see anything on the ground? Oh, now I get. I'm sharing. All right, so let me just stop sharing so that you can see. All right, so can you see our mannequins now on the ground? So the middle one, the first one, okay, can you just touch one after the other? Remove your hand from this. Okay, the first one she's touching is actually the child mannequin. So the next one is the adult mannequin, while the last is the infant mannequin. Like I said, for infant, 1 year downward. All right. So from our acronym, I think you guys should write that acronym down because that is your guide. That is what is going to guide you in helping somebody in an emergency. All right. So the first thing first, when you encounter somebody in an emergency, is to check for possible danger. All right, is to check, even if you know what to do, even if you are a professional and you actually know what to do. First of all, you have to check for possible danger. You don't just jump towards helping somebody because you know what to do. You check for possible danger and make sure that the dangers around that casualty is cleared, because you don't want to also cause harm to yourself. Maybe you are going to help somebody, you're now causing harm to yourself. um, then we'll be having two casualties. We don't want that to happen. So you have to clear the environment, check for possible danger. All right. So how do you check for danger? It can happen in different ways. Maybe it happened to be like maybe an accident scene. It is not advisable to actually evacuate the person from the scene. All right, because you don't know if the person has sustained a fracture injuries or spinal cord injury or neck injury. All right. But if need be, just move the person. All right. If that is the only option, you just have to evacuate the person to the site. All right. But if not so, it is not advisable to just move the person. All right. Maybe the person experienced an electric shock and you have to cut power supply and all of that. Maybe he slip and fall, then you have to clear that place and all of that. So that is it. First of all, just check up anything that will cause the danger. Just observe. Maybe they are playing on the field and he received a direct trauma or something like that. He's on the floor. Either just create a space for them, all right, so that there'll be ventilation for the person to breathe. So that is actually all about D, which is danger, or probably scene safety. All right. So the next letter, because I just want to assume she has checked for danger because I just explained everything about danger. So the next letter we're talking about here is letter R, which is response. All right. So we call for response differently from the way we call for response on an adult is different from the way we call for response in an infant. All right. So for an adult, she'll demonstrate how to call for response. So just kindly watch and see what she's doing. So she'll tap on both shoulders and call out on both ears. The reason why you're calling on both ears, you don't know if the person is partially deaf on one of the ears. So you have to call on both ears. So she'll demonstrate that for us to see. All right. So I want to go. All right. You can see she's not shaking the mannequin as if she's trying to lift it up. Okay, this is what, as if she want to lift it up. She's just tapping on the shoulder and calling on both ears. All right. So that is what you do. And you shout loud. You don't necessarily have to know the person's name. As long as you can identify at least the gender, you can call hello sir, hello ma, can you hear me, all of that. All right. So the next thing, for a child, an infant, sorry, just demonstrate. If you want to call for response for a baby, they are under their foot is one of the most sensitive part at this age. All right. So what you need to do is to tap under their foot. You just tickle them there. If they are still conscious, they will respond to that tickling. All right. So that is basically what you do for an infant. Okay, so that is it. So what is the next thing? The next letter. The next letter is actually letter S. like I said, just try to follow that letter I gave to you, doctors ABC. So the next letter is actually Dr. S. I think somebody
Hello,
raised.
sir.
Okay. All right. All right, ma'am.
Can you please increase the screen so that we can see it better?
All right. Okay. I think I should demonstrate on the table so that I'll come to see that it's too far a bit. All right. It's fine. So let me just use a table to demonstrate, like on a close range. But I'll point out something. It is not advisable to do. I think you should just relax there. Maybe if we have any other thing, we just go because they said it's far a bit. All right. So I think it is not advisable to do CPR on the table, especially for an adult. It is not advisable to do it on an elevated surface like this. Though we watch movies, they're doing it on the bed and all of that. If you are doing the compression, because the bed is soft, the bed can actually take form and your CPR will not be that effective. So the only reason why I'm doing it on the table right now, it is because I just want you to see. All right. But when we want to do actually do, I just want to show you the demonstration. But if you will still come back and do, maybe give the 30 chest compression. But I just want to use a table and just show you what and where you're supposed to place your hand and all of that. So thank you so very much. But for a baby, you can actually do it on an maybe on an elevated surface. All right. Okay. Can you see, need a control? All right. Can you see my mannequin? Okay. I think. Can you see? Is it better now?
Yeah,
Norma,
it
Yes,
is it?
is.
Yes.
All
And
right.
I think those who don't see very well can change their layout.
All
If
right.
you
Yeah.
change the
Sure.
layout, you can have a yes.
A clearer view of it. All right. So this is adult mannequin. Let me pick a child. So for an adult, if you want to call for help, you tap on both shoulder and call on both ears. All right. Hello, sir. Hello, sir. Can you hear me? Hello, sir. You know, remember I said from the beginning of this lecture, I said this process is just for 10 minutes. You run everything, doctors A, B, C, Dr. ABC. Everything is just for 10 minutes. So you are buying time. The reason why I'm taking a little bit of time is because I'm explaining. All right. So once you call on both shoulders, you immediately proceed to doing the next steps. All right. So which is I've checked for danger, tap on both shoulders. The next thing is send for help. All right. For a baby, like I said, it is very easy. If you want to call for response, just tickle them under their foot. All right. So if you want to call for help, if you happen to be an emergency maybe in a building and you have the alarming system there or device, you can activate it for it to ring out. But if you don't, you can shout for help. You have a mouth, you have a voice. Help, 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 but cry out loud. And once somebody comes, tell the person what to do. Call the emergency number 767 or 112. The emergency number in Nigeria is not actually 911. We've had series of situation like that when we are out there for training and we ask what is the emergency number, they'll tell us 112, sorry, 911. So the emergency number is not actually 911. All right, so it is 112 or 767. I think 112 is Nigeria, 767 is Lagos State. So just know that emergency number so that whenever there is need, you can request for help via the emergency number, or you can also use the Tessera app, which I'm going to explain later on in this training. All right, so call for, and once you call somebody, maybe you screen and somebody comes to help, the next thing you do is to give the person a specific instruction. Tell the person what to do. Don't tell the person call the emergency number. The person can be thinking, oh, maybe it's 080, or literally I don't have airtime on my phone to dial the emergency number. Tell the person the emergency number and tell them it's toll free. Tell them everything they need to do to know and do. All right. Okay, the number is 767 or 112. 112 is Nigeria, Why 767 is Lagos State? If you're in Lagos State, I think 767, but if you're in Nigeria, 112, that is the emergency number. All right. So you call the emergency number. Hello, can you hear me? Somebody said my mic is off. Can you hear me now?
Yes, you're clear from this angle.
All right. So you call the emergency. I want the person to come tell them, okay, call the emergency number. Tell them that emergency just happened in, let me just say, Ikeja, number 27, maybe Awolowo Road and all of that. You know, just give them, and the person collapsed. You've called out for response. The person is not responding. Mind you, don't call out for help or don't send for help by calling the emergency number without you confirming if this person is not responding. You must confirm the if the person is responding the consciousness of this casualty before you call for help. Once you confirm, that is when you proceed to send for help. Okay, let me assume I've sent for help by calling the emergency number or activate the alarm system in the office or all of that. So helps have arrived or maybe they're on their way. So the next letter on our acronym is what? Is letter A. All right, which is actually airway. All right, so most of the time, I think here I'm going to share my slide a bit for you to see something, so you will not be seeing this. Let me just kind of share my slide. Okay. Okay. So this particular slide is what I want to show you. Okay. So most of the time, if somebody is a X-ray view of somebody that is unconscious and not breathing. So most of the time, if somebody is unconscious and not breathing and is lying down faced up, you know, our tongue is actually a big organ. It can roll back and block our airway. All right. And once that happens, we'll not be able to breathe. All right. So you can see it from the picture. We have two pictures there. The one that the head is not tilted backward. You can see the airway is so narrow. It's as if there's nothing there. So the person will not be able to breathe. All right, because the tongue has rolled back to block the airway. But if you look at the other picture, that there's a hand on the person's forehead and he has tilted the head backward, you see that it is wide open. So it will create a lot of space, enough space for air to pass. Right. So most of the time, if somebody is unconscious and not breathing, or unconscious probably, the airway, person can still be breathing, but you will not know because the tongue has blocked the airway. So you must confirm if this person is breathing or not. That is why you must do this particular thing. All right, so this is called the head tilt chin lift maneuver. You put your palm on the person's forehead. I think I should use the other. I think I have other picture. Okay, you see the other picture. This is what the person did. All right, the palm on the person's forehead, then two fingers on the person's chin. Okay, let me demonstrate it since I've shown you the X-ray view of it. Let me just stop. All right, so I hope everybody can see. So my palm on the person's forehead, I'm not closing the eyes. All right, then my two fingers, all right, I'll place it on the person's chin. Then I'll tilt the head backward. Don't over tilt, especially if it happened to be an emergency, like maybe road accident, because you don't know, like I said, if the person has sustained a neck injury. All right, so your palm on the person's forehead, you tilt the head backward. All right, then with this, you open the airway and confirm if the person is still breathing. The next letter is letter B, which is breathing. All right. So in this letter, you bring your cheek close to the person's nose. You look at the stomach region if it's rising and falling, or the chest if it's moving. All right. That is when you know if the person is still breathing. And you do that for 10 seconds. I repeat, 10 seconds. So this is what I'm doing. I'm not looking at this direction. I'm looking at this direction. All right, for 10 seconds. So if this casualty is breathing, I'll feel for warm air because I've opened the person's airway. I'll feel for warm air on my cheek or my jaw. Then I'll observe the stomach if it's rising and falling. Then I'll be able to tell if this casualty is unconscious and breathing or unconscious and not breathing. But once I check and I didn't feel the warm air on my cheek and I'm not seeing the stomach rising and falling, then I know that this casualty then I'll know that this casualty is unconscious and not breathing. So what is the next thing I do? All right. So okay, let me just quickly chip this in. You can also check for pulse by the two fingers, place it on the trachea here. All right. Just press it on that vein. You feel the pulse. But we don't teach people, especially if you're not a medical personnel, we don't teach people on how to maybe use to check for pulse. Reason being, because especially if you're not a medical personnel, sometimes because of the tension, you'll be panicking. You can feel for your own pulse here at your fingertip, thinking is the person's own. So we just literally tell you the best way to do it, all right, which is basically bring your cheek close to the person's nose, look at the stomach region if it is rising and falling. All right. So what is the next thing? After doing that, the next thing is to do chest compression because I've confirmed that this person is actually not breathing. All right. So the next thing is for me to do chest compression. And you don't do chest compression, you have to, with the person's clothes on, you have to expose the chest, be it a lady or a guy. All right. You have to expose the chest. But for a lady, try as much as possible to do it with dignity. All right. So you expose the chest because you need to locate the midpoint of the chest. All right. Let me expose. All right, so you expose the chest. I think I should just turn this a bit. Can you see the light is over reflecting? Okay, but this is the nipple point here and here. So basically, you draw an imaginary line. Like I said, imaginary line down the throat and across the nipple. So the midpoint, you place your hand there. All right, but for ladies that are in doubt, at the end of the sternum, the breastbone, just some little calculation, take your hand a bit upward. You can act, even if you don't actually get the right spot, but you get to that maybe you get close to that position. All right, but you can just try it maybe at home and all of that. But for a guy, it is a lot easier. Draw an imaginary line down the throat and across the both nipple. You drop, you place your hand there. All right, so that is it. For an adult, you use both hands and you interlock, right? You interlock your hands like this and you place it on the midpoints of the person's chest. All right. For a child, use just one hand. And for a baby, let me take this out. For for a baby, you either use two fingers on the baby's chest to compress, but it is correct. And for me, I like using the other method because we have two methods for babies. Either you use two fingers or you use what we call double thumb recycling techniques. All right. As if you want to carry the baby, but your thumb on the baby's chest to compress. All right. Look at what I'm doing. You're not supposed to carry the baby, but I just want to show you. Your thumb will be on the baby's chest. All right. To compress. All right. So the baby here or that use two fingers. For especially for ladies that do fish nails, they will not be able to use their two fingers to compress this baby's chest. So the best way is to do what we call the double thumb cycling techniques, whereby you do as if you want to carry the baby, but use your thumb to compress the baby's chest. And I asked the question earlier, how many chest compression to rescue breath? A lot of us got the answer. It is actually 30 chest compression to 2 rescue breath. But what if you're not comfortable giving rescue breath? What are you supposed to do? For example, I don't know, the person is bleeding from the mouth. I don't have a burial device with me. What am I supposed to do? You can go ahead to give 100 to 120 chest compression without the rescue breath. You see, CPR is actually exhausting. All right, that is why you have to call for help before you start. All right, don't just proceed to help the person without calling for help. Because once you are compressing the chest, imagine you are doing CPR, you get to 100 in a repeated cycle, you start again 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, till you get to 100 and you start again repeatedly. All right, over maybe 5, 6, 7 circles. All right, you get tired, and we don't want a situation where we'll have two casualties there. So you have to call for help before you start CPR. All right, so that is it for that. So maybe um after giving CPR, maybe 1, 2, 3. Okay, for an adult, you interlock and your hand should not be flexed. I think this time around, my colleague will need to help me out here because I want you guys to see just as much as possible. If you can. I cannot really do it on the table because I think I'm taller than this table. But okay, let me try to explain from this table a bit. If you want to do CPR, but you have to come and also demonstrate that I don't have to flex my hand from this joint. Your hand have to be straight. All right, every of your joint have to be straight, and you use your body weight my full body weight to compress. I don't try to use my muscle to push down. So I use my full body weight to compress. All right, for an adult, you put and you compress 30 times. And if you want to give rescue breath, let me just quickly show you this. Your palm on the person's forehead. If you're comfortable giving rescue breath this time around, your palm will be on the person's forehead. Then this time around, your two fingers, unlike before, we just put our place our hand on the person's forehead and our two fingers we tilted the head backward to open the airway. But now I've done chest compression 30 times and I want to give rescue breath. I come over to this part, my palm again will be on the person's forehead. Then this time around, my two fingers, I'll close the person's nose ring. Then my other finger, I tilt the head back. Then this time around I'll use my thumb to open the person's mouth. All right. Then I'll give two quick short breath. So I'm going to demonstrate that for us to see. So let me just quickly sterilize this. Sterilize, I don't dry, don't burst. Straight up. Right. So if you want to give rescue breath, your palm will be on the person's forehead, like I said. The two fingers, you close the nose ring. This here, tilt the head backward, and my thumb, I open the mouth. Then I give two quick short breath. See, I don't know if you saw that the chest of this mannequin just move up and down. All right, because it is actually connected. All right, and that is that for that. Okay, mind you, if you want to do chest compression, you have to go as deep as 5 centimeter. I repeat, if you are doing chest compression, you have to go as deep as 5 centimeter. All right, want to like the depth of 5 centimeter. If you should go more than that, you can either fracture the rib cage and all of that, but you have to go as deep as 5 centimeter when you are doing chest compression on an adult. For a child, you can probably fall like an infant. The reason why I said fall, you can, if you're using two fingers, the pressure you are mounting on that baby's chest will be lesser compared to when you are using both arms. All right. So the reason why you're using both arms on an adult is because the rib cage is well developed. All right. So that is what you do for an an adult. So Sterica, please kindly comes. Okay, just wait a bit. If you have your barrier device on, let me just show you what to do. Maybe you have your barrier device with you. All right. As you can see, I just want to show you something. This part should be on the mouth aspect of it. This side is like V, so this side should go to the nose. All right. So you place it like this on the person's nose. So with this, you can actually pump. Maybe if you have a barrier device on and you don't want to put your mouth, this though basically people cannot be walking on the street with this on. I just want to show you. All right. People cannot be walking on the street with this on. But what you need to do is to place it on the person's mouth. You form what we call like an EC or CE, anyone, but EC. Your three fingers here will form E, all right, while these will form the C round this device. Then these three fingers will now form the E to tilt the head backward. All right, but you have to apply pressure to this device on the person's face so that the air will not leak out or go somewhere else. So the air will not maybe pass through out by the side. All right, so tilt it backward with my C, place it on it. Then my E, I tilt the head backward. All right, then I can actually compress one, two. All right, so that is it on how to use this particular device. So let me ask you, okay, should we just come and demonstrate how to do CPR, maybe the right way, just try as much as possible to see or change your distance so that you'll be able to see. I just want to show because doing it on the table will not be that effective, and I don't want you to go with that imagination that that is how it's been done, but so that you can see it while she's doing it on the floor. All right. Okay. So just expose the chest for them to see. If she has, okay, she exposes the chest. Okay, now, so I'm going to count 30 times and two rescue breath. So I want her to position wrongly. maybe you lean backward and stuff like that for them to see so that you know how not to position. You see, right? Actually, she's actually positioning herself wrongly. She's leaning backwards and she's not supposed to lean backwards. She's supposed to be on top of a mannequin and don't flex your hand. Flex your hand wrongly for them to see. Flex your joint. Your joint as if you're flexing it. This is straight. You flex. You're not getting it. This is your joint. So either you're on top with your hand straight. All right. So see, she's flexing her joint from this position, and it's not supposed to flex her joint. Supposed to everything, straighten everything, both side. No, you see, that's to straighten everything and use your body weight to compress. All right. Use your body weight. So I'm going to count 1 to 30 for her. Then I've demonstrated here on how to give rescue breast, so she does not need to do that again over there. All right. So are you ready? All right, so let's go. 1, 2, ready, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, so I see 30. So after that, you give the rescue breath. All right, so I just wanted you to see when she's doing it on the floor. So after that, you give the rescue breath. All right, so you blow twice. If you're comfortable putting your mouth on the person's mouth, you do that and you give the rescue breath twice. So thank you so very much. All right. So, but if you have, I just want to use this again. If you have your AED device with you, you can as well. Let me just show you. It's not difficult to use. It's just for you to follow the instruction for AED device. I'm going to be fast. So this is like practical AD device, so it's not a real one. So this is just for the for practicals. All right, so it's just for, I just want to show you the correct pad placement, but it is something. Yeah. All right, so I just want to show you the correct pad placement. Okay, these are the pads. You placed one. The instructions are clearly stated on the pad where to place it on your casualty. All right, so let me just accept this guy. Okay, so on this particular one, they're asking us to place it on the person's chest. All right, while this, you have to place it by the sides of the person's chest. You can see this black thing here and the arrow pointing out that you have to place it by the sides of the person's chest, while this should be on the this is the right, okay, the right side of the chest. So here, all right. So for an adult, though the placement for infant and child is different for an adult. All right. So for an adult, I'll place this on his chest here. I don't know if you can see, though, but that is just it on the side of the chest, and this other one by the side of the chest. There's a stick. It is sticky, but I don't want to remove the bag so that we'll be able to use it next time. All right, so just place it by the side of the chest. So I just want to take it a bit upward so that it will not fall down. All right, but it should be by the side, somewhere here, below the chest. All right, so I just want to take a bit upward so that it will not fall down. Then this one. So while you're doing your chest compression, so you put on your device. We have different devices. Some are kind of a bit manual, some are automatic, but the one I'm using is automatic. It's just for me to put it on and it will give me a prompt. All right, I don't know if you'll be able to hear the prompt from my mic, but it will tell me when to deliver, when you want to deliver a shock, when a shock is advised, when it has found a normal reading, an abnormal reading for it to deliver a shock, and all of that. All right, so the major reason for AED device, especially if is when your heart, the use of AED device is to help bring your heart back to help your heart pump out blood and to bring your heart back to a normal rhythm. Because at this point, it's as if your heart is, um, is reading abnormally. So the AD's device help to find this rhythm and try to shock and bring it back to a normal rhythm. All right. So that is what we're trying to do here. Okay. So I'll put it on now. So maybe while I'm doing my chest compression, okay, as you can hear, he said assessing the heart rhythm, and he has advised me not to touch the patient. So I'll stay off or clear from the patient. All right, they have it has actually advised me to press the shock button. So as you can see, this is the power button, and this is actually the shock button. It's just for me to press the shock button, and it would deliver a shock on this casualty. All right, so which I'll do. So I don't know if you heard what it has said. First of all, it advised when I was doing the CPR, it advises me to let me just put it off. So it advises me to, when I was doing it, it advises me that you want to like checking the heart rhythm. And once done, it told me that, okay, an abnormal reading has been identified, that they want to deliver a shock, that I should stay clear of the patient, which I did. So it is very, very easy to use the AED device, especially if it is an automatic one. Just follow the prompt and you'll be able to help save this casualty. All right. So thank you. So that is basically it. Okay, for a child, if you want to place the part placement, because if the person is a child, you place one here and the other one at the person's back, the back of the chest. All right, for an adult, it is by the side and one on the chest. While for a child, you place one on the chest and the other one at the back of the chest, at the back. All right, back side of the person. Okay, so I'd like to chip this in. There are four reasons why you should stop CPR. For example, I'm doing CPR and the person shows sign of life. I'm supposed to stop doing CPR, especially if it shows sign of consciousness. I'm supposed to stop CPR. But what if I'm doing it and the person does not show sign of life? I continue. All right. But if the person shows sign of life, I have to stop doing CPR. So the second reason why you should stop CPR is when you're tired, you have to stop. It is not a do or die affair. All right. So if you're tired while you're doing CPR, you just have to stop doing it. All right. So the next reason is if a professional helps arrive, maybe because you call for help at the initial. So once they come, you have to stop doing CPR. And the last reason is if the place become unsafe, especially if you're doing it for maybe they happen to be like a Muslim lady and all of that, you cannot just expose them like that, especially in their community. They'll think you want to do something else. Meanwhile, you're trying to save that person. So you have to look at all of this aspect before you try to save somebody in an emergency. All right. So that is basically it about CPR, unconscious and not breathing casualty. So the next thing I'll be talking about is unconscious and breathing casualty. All right. So I've spoken about unconscious and not breathing casualty. So I'll be talking about unconscious and breathing casualty. It is basically almost the same like unconscious and breathing casualty. So the only difference is that the last letter will change from probably letter C to letter R. All right. So the first time you did DRS ABC, but this time around you're going to do DRS DRS ABR. Arrow stands for the recovery, right? So once you get to letter R, you put the person in a recovery position. So first of all, you come to the scene, you're in the scene, you check for danger, possible scene safety, and there are no danger there. The next thing is for you to check for response by tapping on the shoulder. No response. Then you go ahead to send for help. After sending for help, you do the next thing, which is airway. And once you maybe check for breathing and you discover that the person is breathing, instead of you doing CPRO. Okay, I didn't mention CPRO stands for cardiopulmonary resuscitation. Instead of you to do CPRO, you have to change from C to letter R. So the only difference is the last letter. The first one was C. The last, this particular one is letter R, which is recovery position. Okay, lest I forget, let me quickly chip this in. If somebody's unconscious and not breathing, the heart has stopped. At that point, the heart will not be pumping out blood again. So you do what we call the pseudo heart, which is the first heart, by helping to pump out blood to the various organs of the body. All right, shortage of oxygenated blood going to the brain within the space of 5, 6, 7 minutes, some of the brain cells will start dying. So 10 minutes and above, some of 10, 15 minutes and above, some of those dead cells will become irreversible. So that is why even if they recover, sometimes they develop a complication and all of that. So you don't want that to happen. So you must try as much as possible to help manage the situation. All right. Okay. So that is basically it. So in an emergency, first of all, like I said, the first 10 minutes is very, very important. Like I said, shortage of oxygenated blood going to the brain within the space of 6, 7 minutes. Some of the brain cells will start dying. 10, 15 minutes and above, those dead cells become irreversible. That is why the first 10 minutes of an emergency is so important. That is why you must know what to do. That is why you must be there to help. That is why I gave you the 5 P's of first aid, which is to preserve life and all of that, and to prevent the injuries from becoming what towards time from causing harm. All right. So you have to know all of this. Okay. So I would like to demonstrate the recovery position. So my colleague will also help me demonstrate the recovery position. Okay, please.
Please, you're muted. We cannot hear you.
All right. Can you hear me now?
Yes.
All right. So the recovery position, like I said, I think we should start again. So the irrespective of how the person is lying down, you have to turn the person to face this direction. The person face must be face. You must face the person upward. All right. Then you move the person's hand, depending on when you're standing. It can be on this side or the other side. Wait, I'm still explaining. So the person's hand can be on both sides. Maybe she can be on either side, either here or where she's kneeling down now. So because she's there, she moved the up hand close to her to the lady's side. All right. So now she'll pick the other hand. She interlock with the other hand. So kind of interlock. She interlock with the other hand and bring it to the lady's cheek, because this particular hand will act as the pillow hand. All right. When she's done. All right. So she's not. Her hand still remains there. She didn't remove her hand. All right. Then she'll pick the lady's knee joint. She flexed from the knee joint here. As you can see, she flexed from this part. Her hand is not inside but outside. So I want her to do it wrongly for you to see. So that place your hand wrongly. Right. You see, she's picking once she picks inside, she actually picking it wrongly from the inside. She's supposed to pick the knee joint from the outside. If the person is on the bigger side, you can pick from the trouser. As long as the person is unconscious, the knee joint will always flex, all right, because it's a joint, so it will always flex for you depending on the size. All right, so the next thing, you move backward and turn the person, irrespective of the size. Also, the person will always flip. So once the person turns that way, you can adjust the chest, move the leg also forward, so that the person will not roll back, tilt the head backwards again, because in this particular position, you have to also open the airway. All right, so she will tilt the head backwards again, and from time to time, you use your two fingers, come close to the person's nose. If the person is still breathing, you will know. But maybe if you come to check and the person is not breathing, you have to flip the person back and you initiate CPR again. So that is basically it about the recovery position. Do you mind if you should do it again? Oh, we are good to go. Did we get the process, or we are good to go? All right, I think we are good to go because nobody's responding now. All right, so thank you so very much for that. So that is basically about the recovery position. So let me go back to my slide and see the next thing we'll be talking about. All right, so I want to share my slide again. All right, this is how to check for breathing, which, okay, I think is still processing. This is how to check for breathing, which I've explained earlier on. All right, then CPR, I think I've done that. Okay, see the positioning and all of that. See, for a baby, you don't necessarily, for baby, like a child, sorry, one hand, you don't necessarily have to hold the child on his head, but that is just the right position. You can see the hand is so straight. All right. Okay, if you want to give CPR for baby, like I said, you don't necessarily have to put your hand on the baby's head. All you need to do, two fingers. They didn't do the interlocking process yet. So this is the barrier device, which I just explained, and all of that. So this is the recovery position she also did right now. You can see from the picture, the other hand on the side of the casualty's face, while the other one on the leg. You flip. Once you flip, the other picture shows the position. So that hand that you used to put on the casualty face will act as the pillow hand. All right. Then for a child, it is self-explanatory. I don't have to do that. It's just for you to carry the child. Make sure that the baby's face or nose is not on your body, so that the baby will be able to breathe. All right. So that is it. And you flip the baby. You slightly flip the baby. See, the baby is not just straight. All right. So he slant the baby a bit. So that the baby, that is the recovery position for a baby actually. So just slant the baby a bit so that the baby will be able to breathe, and don't bring the baby's face to your body, because the baby will not be able to breathe. All right. Okay. So I think I should be moving to cuts. Okay. So cut can be defined as a break in the skin by sharp or jagged object. A puncture wound is one made by a sharp object like a nail or a sharp tooth. So what are you supposed to do if you experience a cut? Okay, especially for a minor cut. This is actually a minor cut. All right. So watch out minor cut with clean water, dry completely, and then cover with a clean bandage or a band-aid and antibacterial ointment. Do not apply hydrogen peroxide methylated spirit, as it can cause delay in wound healing and in some cases consistent bleeding. All right, because actually those hydrogen peroxide are there to fight against bacteria and to fight against bacteria and all of that. That is why they just said, okay, don't apply all of that. All right, just apply pressure. And mind you, if you have a cut, okay, let me just cast our mind back to when we were still a child. You have an injury, from that injury, when it's dying off, it will form something a like a image. You see something like hair coming out. All right, that is actually what is forming there, like a clot. So once you apply pressure, you reduce the amount of blood that will be flowing to that particular spot, and the blood around that axis will try to form a midge, all right, around that axis, like a woven stuff, so that blood will not be able to flow out. All right, so that is basically it. Just apply pressure, but first of all, you have to wash that environment, that place, the spot, with clean water, running water. So I'd like to ask a question before I proceed from here. Why are we advised to wash the injury with clean water? Why are we not supposed to maybe wash it on a bowl of water that is not running or all of that? They said we should wash it with clean running water. Why are we advised to do that? It's a question. Okay, I think somebody just raised a hand. Okay, you can answer the question if you have answers to it. Just unmute and answer. Do you have answers to the question? I should just give the answer so that we'll not waste take our time. Okay, I think you should answer the question. You just raised your hand. Just go ahead to answer the question. Okay, I think we can actually hear you. I can hear you. No, I can hear you. I think you're muted. Just unmute your this thing. Let me see if I can do that here for you. Okay. I want to try if I can unmute you. I actually cannot unmute you now. Okay, but if you can type the answer, it's fine. Or let me just give the answer. But you can still drop it there, Shay. You can. I can hear you. We can hear you. I don't know if any other person can hear you, but I can actually hear you. You're still muted. Just try to unmute and give the answer to the question. You're still muted. The sign is still showing there. Okay, let me just give the answer so that we'll not take more of our time. Okay, okay, but if you have the answer, just unmute and answer. It must not be her because some people are still raising their hand. If you have the answer, just unmute and answer so that we just save our time.
Hello, can you hear me now?
Okay, I can hear you now. I can hear you
Okay,
now.
it's just to prevent bacteria from entering into the body or entering into the cuts.
Okay, let me repeat the question again. I said, why are we advised to wash our hand on a running tap, like tap of water that is running, that is moving, and not to wash maybe on a bowl of water that is not, maybe you can still wash your hand on a bowl of water and still throw the water later. But here they are advising us to wash our hand on a running water, not on a bowl of water. Okay, it's fine. Maybe as I'm explaining, I'll give the answer in the next thing. All right. Okay, thank you so very much. Okay, let me go back to my slide. Okay, so like I said, you apply pressure. Can you mute now so that you will not be distracting? It's also disturbing my sound. Okay, say apply pressure. First of all, you wash the place, then you apply pressure. If you have bandage, you can also use bandage too. I think you should mute now, please. Thank you,
All right.
because it's disturbing my own sound now. All right. So if you have bandage, you use that, apply on it. So for deep cuts, it's also the same thing. But some deep cut, you can actually, maybe the injury is open, all right. But they said apply direct sustained pressure. This is, you have to sustain the pressure on that part. Apply direct sustained pressure over the wound or cut with a clean cloth for 10 minutes until bleeding stops. You have to apply that pressure for 10 minutes. I just emphasis should be on that 10 minutes. Apply a sustained pressure for 10 minutes. If the bleeding continues after 10 minutes, call the emergency number. All right. If it soaks through the cloth, don't remove it. Place more cloth and continue to apply pressure while taking the person to the healthcare facility, because we each person have an average of 5 liters of blood in his or her body, so you don't want to waste any of it. Right, that is why you must apply pressure and try to take the person to the healthcare facility. All right, so I'm not going to take shock today. So I think, though, you can learn about shock on the full slide, which I'm going to explain later. Let me just go to nosebleed, because these are just common emergency that we experience every day. All right, so nosebleed. Okay, let me take it out and ask a question. I have a question for nosebleed. I also have a question. So let me stop sharing my slide and ask the question. Okay, my question for nosebleed goes like this. If you're bleeding or peradventure, you receive a direct trauma on your nose and you're bleeding from your nose, what are you supposed to do? Like, if you're a first aider, what are you supposed to do to help manage the nosebleed? You receive a direct trauma from your nose and you're bleeding profusely from your nose or severely, what are you supposed to do? So what are you supposed to tell the person? Okay, do this, do that, do this to help stop the nosebleed. Do we have any answers to it? Even if you don't, even if you have answers and they're not correct, just try.
Hello.
Okay, I can hear you. Thank you once
The,
again.
the first thing you should do is to sit the person down. Let the
Okay,
person sit down and
okay,
turn his head backward
okay,
for like maybe 5 minutes.
okay,
Before you know it, then you cover the nose with a white handkerchief
okay.
and give it some time. After some time, the bleeding will stop.
All right. Thank you. Do we have any other person with answer, or we are all going with her? Do we have any other answers, or we are going with her? Okay, somebody said raise the head backward. All right. I think everybody is raised the head backward. Okay, that is actually wrong. Though, okay, I think you can mute again. Your sound is also echoing with mine. Okay, that is actually wrong. You're not supposed to ask or advise the person to tilt the head backward. All right. Do you know that can our system digest our blood? Once you're asking the person to tilt the head backward, invariably you're asking them to swallow their blood because it's going to their stomach. You cannot breathe with your mouth, you can breathe with your nose, all right? So invariably you're asking them to swallow their blood and it goes to their stomach. It can cause what we call like a nausea. Is seem to as if they want to vomit and throw up and all of that. So it is not advisable, because we are not animals, to tilt our head backward. If you should ask them to tilt their head backward, one, you will not know the severity of the injury, because the amount of blood that will be rushing to the person's system, you will not know to be able to stop or rather to take the person to the healthcare facility. So what they are supposed to do, first thing first, it is not advisable to come in contact with somebody's blood, all right, because you don't know health wise their condition. So it is not advisable to come in contact with somebody's blood. So what you're supposed to do, first of all, if you have a glove, put it on. But if you don't have, you can improvise. If you have a clean nylon, just tie it around. some people will say, can I use handkerchief? You can use handkerchief, but handkerchief will soak through. But if you have a nylon, just try to, you're just trying to improvise. And this is safety here because you're trying to help. All right. Like I said, each individual has about 5 liters of blood in his body, and it is not advisable to lose that. All right. So what is the next thing you do? The person can sit, if you have a seat or maybe on the floor, and tell them to lean forward. You're not supposed to lean backward. But our parents will ask us to, even while I was growing up, I also have that idea that you're supposed to lean backward. Our system is not designed in any way to ingest our blood. All right. So they're supposed to lean forward. And now you pinch the soft aspect of their nose for 10 minutes. You said 5. Okay. You pinch the soft aspect of their nose for 10 minutes. They can be breathing through their mouth. All right. Pinch it for 10 minutes. At that point, like I said earlier on about the minor cord, once you apply pressure like that for 10 minutes, the amount of blood that will be flowing to that particular spot will be reduced, and the blood around that spot at that time will start to form the clothing around that place, like that midge. Like I said, you form a mesh. Sometimes your wound is dying off. You see like something like hair, something like that looks like wool and stuff like that. All right. So to form that midge and all of that, so that it will prevent blood from flowing out of that place, out of the injury. Right. So that is basically what you should do. Apply pressure for 10 minutes, the soft aspect of the nose, the bridge of the nose. Pinch for 10 minutes. Person should breathe from the mouth. But if after 10 minutes the bleeding still continues, then you have to take the person to the healthcare facility because it is a serious injury. All right. They can actually work on it on how to stop the bleeding. Right. But if you have an ice pack also, it's something that you can also use, because once you bring the ice pack close, it is not also advisable to bring an ice like directly to the person's skin, because you can injure that person. If you have a clean towel, you can soak the towel, put the ice in between the towel, and just apply it on the person's nose. It will help to also reduce the amount of blood, because as if you want to freeze that place or freeze that place. So you help reduce the amount of blood that will be coming to that place, because the blood will get thicker. All right. So lesser blood will be flowing to that place, instead of when the blood is so light, it will just flow deep down to that nose ray and will be coming out. All right. So you can use an ice pack, or you just pinch the bridge of the nose for 10 minutes. And if it's a minor injury, you will stop. But if it's a severe one, then you have to take the person to the healthcare facility. Mind you, first aid is just to help by time. It is not as if it's something that will completely stop the situation, but it's just to help by time. All right. Like for people experiencing cardiac arrest is actually an abnormal rhythm of the heartbeat. That is why I talked about the AED device. All right. It helps to bring the heart back to its normal rhythm. So once your heart is beating abnormally, mind you, I didn't say something when I was teaching about CPR. For example, you're doing CPR and somebody shows sign of life. Don't say no. I was taught that I have to do up to 30 before I stop. As long as the person has shown sign of life, you have to stop. Even if you just started doing it, you just do maybe up to 5. The person shows sign of life, you have to stop CPR. Don't continue CPR. Then you put the person, once the person shows sign of life, you have to put the person in a recovery position, because as at that time the person has not fully gained consciousness. All right. So you have to put the person in a recovery position for the person to fully gain his or her consciousness back. So that is it for it. Okay, I think I'm going to move over to the next topic because of time. Let me try as much as possible to be fast. Let me go to my slide. I think the next slide. Okay, so that is it for nosebleed. Let's say if a casualty get a nose, I've explained this, so no need for me to read again. Okay, this is the medicine number 112. Okay, choking. Okay, briefly, I'll talk about choking just briefly, but you can get the full slide on our website or the app that I'm going to introduce to you later on. Okay, choking definition is a difficulty in breathing as a result of blockage of the airway or lack of airway. In adult, a piece of food often is the culprit. Young children often swallow small objects like batteries, button, etc. Because choking cuts off oxygen to the brain. They're telling you about choking. Choking actually cuts off oxygen to the brain, So you say administer first aid as quickly as possible. So actually, this is the universal sign of choking. You know, if you're choking, basically, uh, without your willpower, you're not controlling yourself. Most of the time, you're choking. You see, your hand will just come to your neck or your throat just to hold, try to cough out that thing. So that is what I'm trying to show you. And we have two types of choking. We have the partial choking and the complete choking. We have two type of obstruction: the partial obstruction and the complete obstruction. So what I'm teaching you right now is not the partial obstruction. Any choking or obstruction that you can still talk, say something, it is not a complete one. But the one that you'll be unable to say a word or do anything, that is a complete obstruction. That one can cut the most. It is not common. We don't, because we don't likely experience it. But once it happens, most people will not be able to communicate or say a word again, because and it will cut the oxygen supply to the brain and the various organs of the body. All right. So what I'm teaching you right now is the complete obstruction, not the partial, because sometimes you can be eating fish bone, maybe got stuck on your throat. It's something they'll just advise you go and swallow something or to take this and all of that. So that is not what I'm talking about. The choking I'm talking about here is the complete obstruction. All right. Okay, maybe you swallow ball and all of that. So I'll cite one example to explain this. We went for a training one certain time at Lekki. Then I was been trained, but she wasn't trained. So she said her son background issues and all of that. He said the son went to eat in an eatery. Because of the way he stepped into the eatery, everybody was just looking at him. "Ah, this one a Yahoo boy and all of that," because of the way he was dressed and all of that. So this is the son narrating to the mom, and the mom now narrating to us. So the son said he bought me two meat. So he said while he was eating, the meat was so strong he could not chew them. The meat was so strong he could not chew them. So he decided to swallow the meat. The first one, he decided to swallow it. So when he swallowed the first one, it went through, but it was hard for him to swallow. So the second one was so strong because he used his money to buy the meat. He decided to swallow it also too because he does not want to waste it. And when that happened, the meat got stuck. He could not cough them out. It's as if two hard meat is in between your airway now. Truth. You cannot. He couldn't cough it out. He couldn't take it in, and his airway was blocked totally. So what he started like screaming and going to the floor. Everybody left him, and according to him, he said they were saying in time don't come after using somebody for ritual and all of that. And meanwhile, he was dying. But because they were thinking otherwise that he's a ritualist or a Yahoo guy or something like that, they could not just help him. So because he was trained before, he did the maneuver, which we are going to demonstrate here now. All right. So, but I'm just going to explain a bit about it. So by giving he could not give himself back slap, but he did the other one, which is the abdominal thrust. All right. So for you to do an abdominal thrust, let me see if I have a picture of it here. Shoot. Okay. 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 The first one here. See the lady leaned forward a bit. The guy will give him back slap, 5 back slap in between the shoulder blade, either hitting the lady on top or in between the shoulder blade. You hit as if you want to like he's taking his hand forward. So we'll demonstrate that for you to see anyway. So that is basically it, how to give the back slaps. So after the back slap, this is the abdominal thrust. All right, you make a fist and you put it in between below the sternum, the rib bone. You should use your own hand and feel yourself below the rib bone. That spot, you put that fist and you clasp on with your other hand to push inward. All right, so we are going to demonstrate that shortly. Um, Let me stop sharing my slide. This is the last one is for a baby anyway. Um, okay, so Sterica, please, I need you to help me demonstrate choking for them to see. Choking maneuver. You guys should audio now. Don't worry, it's just a light one. So actually, what I'm saying, telling her now, we are not going to apply much of a force because she's actually not choking. It's just for us to demonstrate for you to see, all right? So since she's not choking, we are not going to apply so much force so that will not allow her to throw up here. All right. So she's just going to show you the hand demonstration. But first of all, this is how to make your fist. All right. So you can see, I make a fist. Are you guys seeing me? Let me see. Let me see. Okay. So I make a fist with this. So this is what I'm going to use. You put it um no down of your rib. Can you see me? Maybe this is my rib. So below my rib cage, so because I'm putting on shirt. Below my rib cage, I make that fist, all right, like this. I'll place it there. Then on your other hand, you clasp over, you push inward and forward as if you want to lift the person up, but basically you're not lifting the person up. So once you do that, that is the abdominal thrust. The person will be able to expose that object out. All right. But first of all, you give 5 back slap. You take a good stand by putting your leg in between the person's leg. Okay, let me leave the shot. Okay. Okay, I think they're showing a bit. All right, so if you can see, let me just take it down so you can see her legs. She opened the both legs. She puts her leg in between the lady's leg, because if she does not do that, once she flips the baby back, the lady backward, the both of them can fall. All right, so you don't want that to happen. She has to take a good stand by putting one leg backward and one leg in between the lady's leg. All right, so let me take it up what for you to see. All right, so tilt forward a bit. So you give 5 back slap. One, I think it should be by the side, like, okay, okay, by the side, you can see. So 2, 3, 4, 5. So just do as if you're choking, sis. Hello. No, your hand on your throat. Your both hand on your throat. You don't have to make the sound. All right. So you give her 5 back slap. 1, 5, give back, but not too hard. Normally, on a risk emergency, you have to give it hard, all right? But because she's not actually choking, that is why we are doing it so light, all right? So 5 back slap. So once she's done with a 5 back slap, she'll make that fist. Show them your fixed hand, all right? So she'll put it below her breastbone, rib cage, immediately after the sternum, the end of your sternum. Just place it there. Then you clap. You see, with the other hand, she claps. Then pull inward and forward. See, but she does not want to apply much of a pressure. But you can try it and see the kind of pressure you
Because
see. If you try it, you know how you feel. Then you'll be able to tell the difference between when you didn't do anything and when you do that. All right. So that is all about choking. So I'll quickly demonstrate for a child. If you want to give choking for an infant, so I have to sit to do that. You don't have to stand when you want to do choking for an infant. So I have to sit. I just hope you can see me. Let me move backward a bit. Okay, so let me shift this. Am I coming here? Am I going off? No, I think I should. Yeah. Okay, for an infant, first of all, I have to straighten one of my legs. All right. So you have to sit, and I'll take one of my leg forward. All right. Then why the other one still like this? Why the other one I take forward? All right. So you can see, first of all, you put the baby's leg in between your leg, in between your hand, sorry. So baby legs are in between my hand. So with my with this leg tilted forward, and my index finger supporting the baby's head or neck so that the thing will not, fall down. All right. So like this, I'm holding the baby's head. Then the baby is tilted and downward like this in this direction. All right. So you hit in between the shoulder blade of the baby's back. All right. So 1, 2, 3, 4, 5. Then with this hand, you support the baby's head also with your hand. You flip the baby to this side. All right. The baby's leg is in between my hand, also on this other side of it. Oops, sorry, I don't know if you can see me. So the baby's leg is also in between my hand on the other side of it. So from here, either you can lean forward to check if the object is out. If it's out, it's something you can easily pick. Just use your hand to remove it. But if you know that it's not that out, don't stick your hand inside so that you will not push it further. All right. So this time around, you have to cut your nails because you cannot do you have to give the chest thrust also. So you have to use your two fingers to do this. You don't do the double thumb cycling techniques we did earlier. All right. So use your two fingers to compress the baby's chest. One, two, three, four, five, six, seven. Sorry, it's actually five. One, two, three, four, five.
Move it.
Hello, I think you can mute your mic so that we can hear you. What's the name? This is Sola. Please kindly mute your mic so that you'll not be distracting us. So you compress the baby's chest 5 times also. One, two, three, four, five. You do that in 3 cycles. If the object is still lodged inside, is still inside, you do CPR, because as at this time, this baby will lose consciousness because the baby is unable to breathe, and you're doing this flipping up and down. Baby will lose consciousness after 3 cycles. Then you do CPR to bring the baby back to consciousness again. So that is how to do CPR. First of all, the baby's head is facing downward. One, two, three, four, five. You flip to the other side and you give chest compression 3 times. Like you do it in a repeated cycle, but chest compression like 5 times. Look at the baby's mouth. The object is out. Just kindly remove the object from the baby's mouth. So I'm going to share my screen again to talk about the next thing. Toyebi, please, your mic is on. Kindly mute. All right. Thank you. Let me see. Sorry, the charger is there. You can charge it while you're using it. Let me see if I can use her. All right. So the next thing we'll be talking about. Let me share my slide to now. Okay, so this is for baby. You see, she was giving the chest thrust and the back slaps. All right. Okay, so the next thing I'm going to talk about is asthma. You can see the 3 pictures, the diagram here on this picture. First of all, let me define. Say asthma is a medical condition which affect the respiratory system, causing the airways to become narrow, leading to difficulty in breathing. This can become severe and in some cases can lead to death. All right. So it is a difficulty in breathing that causes the airway to become so narrow and the person will not be able to breathe or say a word again. So what should you do? What are you supposed to do? All right. Actually, you cannot use the inhaler to you cannot say because you know what to do, the inhaler is not important. The inhaler is always important and it's something we should always use. All right. But this is just like a tip to help you whenever this is happening. All right. So let me go back to my sorry. All right. So you can see the first diagram here. This is the airway. There are 3 diagrams. One is wide open, one is semi, and the other one is so slim, like it's as if you want to form something like a star. All right, the last one. So the first one is widely open. All right. So that one is the airway of a person, of a normal person that is not suffering from asthma, that does not have any asthmatic condition. While the second diagram, the second airway you're seeing from this picture, is the airway of somebody that is suffering from asthma, an asthmatic patient. Let me use that word. It's an asthmatic patient, but it is he or she is not suffering from the attack as at this time. While the last one is somebody that is suffering from an asthmatic attack. All right, you can see the difference. The first one, the airway is so open, air can easily pass in and out. The second one is narrowed, so air can just pass in, but not that very well. Right, the last one, air for air to pass, it will be difficult for air to pass because it has been constricted or like this together. All right, so what should you do? Like I said, this is not a replacement for the inhaler, but it is something that can help, you know, it's something that can help when somebody is experiencing this asthmatic attack. Okay, so first thing first, you do what we call the pulse lip breathing. As you can see, okay, I think I should use my hand to demonstrate something. So I'll stop sharing. Okay, I want to use my hand to demonstrate. For example, this is the airway from here. So this is the airway of a normal person not suffering from any asthmatic. It's not an asthmatic patient. All right. So for an asthmatic patient, from this position, the airway will narrow to something like this. All right. But he's not suffering from the attack now. But if you are suffering from the attack, the airway will reduce a bit again. You see, the space is so small for air to easily pass through. All right. So that is the reason why whenever they are facing that attack, you see they are trying to sip in more air, and meanwhile it is dangerous for them, because as you are doing this, you are the brain cells around your airway is sending more signal to the brain that something is coming against him, and you'll be pushing more, like sending more signal to the cells around the airway, and they will become like they will come together again to constrict. They will further constrict, leaving the airway narrower. You see, everything that you are doing as at this point is causing the airway to become so narrow. So if they are experiencing that asthmatic attack, they are not supposed to try as much as possible to breathe heavily, to breathe, try to sip in more air, or try to breathe in more heavily, like because most of the time that's what they try to do, try to force in more air. All right, so that is not right, especially if they don't have the inhaler with them. So what they are supposed to do, or as a first aider, what you're supposed to advise them to do, you do what we call the pulse lip breathing. Do as if you are breathing from your, either you are breathing from your nose or mouth, but as though you are breathing from a straw. We all have taken a drink, maybe a Coke, bottle of wine or anything with a straw before. You know, the straw is very, the space or the pathway or passageway, anyone, is so narrow that it's something you can just easily sip in your drink from. All right. So do as though they are breathing from a straw by sipping the air. All right. So I just want to demonstrate with my lips in that pattern. All right. So they can sing, lean forward a bit. All right. Don't advise them to lie down, because they will be doing more work. Their diaphragm, if you are breathing, your whole system, your diaphragm is going up and down. So if you are lying down, you are doing more work. You're pushing more work to your diaphragm to be moving up and down. But if you are sitting down, it is better. All right. So don't advise them to lie down. They should sit and do the pulse lip breathing. Just lean forward a bit and sip, as if you are sipping air. Remember, I said the space is so narrow. So if you are sipping air, the amount of air that will pass through this space this space will be able to contain the amount of air that you are sipping in. But what if you are forcing more air to pass through this place? Because the amount of space here is so small, the air will be coming and be hitting on the body of the airway. And that body, the cells around there will be sending more signal to the brain, and the brain will still want to further constrict this place. All right. So the thing will become more narrower, like I said earlier. So don't try to force in air. Sip it. Once you sip, you release it again as though you're sipping it. That is why it is called the pulse lip breathing. All right. Pulse lip, because you are doing as if you are sipping it from a straw. A straw. Like that. So that will help manage the situation while you transport the person to the healthcare facility, or you get the inhaler. What the inhaler does is to help widen that place again, to help open it. The air will now become widened. All right. But since you don't have the inhaler, you can do this method and air will be able to penetrate. You will not die. The air will be able to penetrate through that place, and the cells around that region will be relaxed enough for you for you to breathe normal again. So that is it about asthma. So I think let me quickly talk about one topic before I call it a day, then we can learn the other ones online, because we have several topics, but I'm just trying to touch the important topics for you. um what's the time? Okay, let me send the slide. Okay, so that is it. about asthma. Like I said, there's no replacement for an inhaler. Okay, let me talk about bond lastly. Then we have so many topics. Seizures. Okay, I'll just talk about two topic, but I'll not talk about snake bite. Something you can also get evacuation techniques, how to evacuate somebody in an emergency, and all of that. There are methods you use. You don't just use anyhow methods. There are different methods you can use to evacuate somebody. So, but you can get all of this on our training slide. But because of time, I just want to quickly talk about. I would love to talk about snake bite because it's something everybody needs to know. But let's see how time permits me now. So let me just quickly talk about burns. All right. Burns are injuries that damage and kill skin cells and are most commonly caused by exposure to either flame, hot objects, hot liquids, chemicals, radiation, or a combination of all of these things. All right. So example of burns. So these are just people that experience burn, either hot water, bite, chemical, and all of that. So there was a question I asked earlier on, I think. Okay, okay, I'll ask another question here again. First aid for burns. I say, first of all, let's say douse the burnt area with water for at least 10 minutes. That means throw water like you running water. I've asked the question earlier on that why is it not advisable to soak a hand inside the water and just put it under a rushing tap. All right. So now again, they're asking us, they're telling us, douse the burnt area with water for at least 10 minutes. Number two says remove any jewelry from the affected area. Cover the bond with a sterile dressing. Leave bonds to the face and neck exposed. Give fluids if safe. I would like to 1, 2, 3, 4. The number four says leave bonds to the face and neck exposed. I would like to say this: bonds to the face or neck. Our face and our neck region are so sensitive. All right. So whenever we express the bonds in the area, we are not don't just leave it. Take the person to the healthcare facility, because once you try to help the person or do anything, maybe any medical, maybe first aid, you can damage any cells. And once you damage any cells in the face or the neck, it can lead to another complication. This aspect of our body is so sensitive, the face and our neck. So once you experience burnt on these two parts of the body, try as much as possible not to do anything. Just take the person to the healthcare facility. They're in the best position to actually address all of that. All right. But if it happens to be maybe on your hand, your leg, and some part of the body, just douse the area with cold water. And they said remove any jewelry from that place, because you might experience swell and all of that. So you don't want that to the ring to since it cannot take form, you keep that swell and give it another form. All right, so remove any jewelry from the affected area, cover the bones with a sterile dressing, and leave bone to the neck. Okay, I've said that. Give fluid if safe. See what you should not do. They don't touch the area unnecessarily, and do not burst blisters. All right, just leave it. Don't burst the blisters. Don't apply cream, butter, salt, or herbs. Remove clothing stuck to the bone. Say don't sorry, do not remove clothing stuck to the bone. Also, went for a training one certain time, and the mother was also sharing with us how the mother was sharing with us how either son or daughter, I've forgotten, but it's as if hot water poured on the baby or something like that, and they wanted to remove the baby's cloth. The skin went alongside with it. I could imagine the pain that that baby will go through, even the mother, the trauma. All right, she did that deep down her. She wanted to save her a son or daughter, but because she does not know what to do, she ended up causing more harm than good. All right. So if you don't know what to do, it is better you just relax and take the person to the healthcare facility. But you're not expected to remove the person's clothes, all right? Because you will go with the fabric, especially if the fabric is stuck to the injury. Don't try to remove it. Take the person to the healthcare facility. They have the necessary or the right tools to remove it. And they say don't apply cream, butter, or salt. Actually, this is actually standard health standard that we are teaching you. But that does not mean some of these things are not correct. Applying cream, for example, they say don't apply something like pap, but pap actually works. For example, you had a bond on your leg PAP is something that can absorb heat easily. The reason why you're dousing pouring cold water or running water on that injury is to help reduce the temperature in that part. All right. So PAP is one good thing that help absorb a lot of heat. But now, because it is not being proven globally, they're asking us not to apply cream, honey, all of that. But these are something. These are things that our parents have used and that's worked for them. All right. So though what I'm telling you is something that has been proven globally. All right. But if you're okay also giving using these things, it is for your own best practices. All right. Um. So you said don't apply cream, butter, soda, and all of that. Okay, so from our own training, we will not advise you to do that, but our parents has used it and it actually worked for them. Like I said, using the PAP is a good absorber. It can absorb the heat and help reduce the temperature in that place. All right, and do not burst blister. Okay, so I'd like to ask the question again, which I've asked before, but this one is on bond. All right, so I'd like to hear your answer. Why are we also advised not to put either the bond part in a bowl of water? We are advised to douse the area with it on a with a running water. Maybe you train water on it and it's running out. We're not advised to just maybe put that part inside a bowl of water. Do you have answers to it? Maybe you have a bone. Maybe let me use your hand. You have a bone on your hand. You're not advised to soak it in a bowl of water. You're advised to just throw cold water on it for it to get cooler. Why? Is there a reason why you're advised to do that? Okay, because of time. Do we have? Let me see if somebody raises his hand. Okay, let me just quickly answer the question. Um, the reason why you're not asked or advised to soak that part inside the water, especially for the bond, is because in physics, especially those of us that are doing physics, they'll tell you um, heat lost is equals to heat gain. All right. Okay, I'll cite an example. For us mothers, if we want to feed our babies, once you make that pap or probably the custard and it's hot, you cannot feed your baby while the food is still hot. So you have to put it on a bowl of water. And once you do that, the water will become hotter while the pap will try to get cooler, right? So that is just basically it. It's not as if there's science behind it. So as if there's a special science behind it. So once you put that burnt part in the water, the heat on that hand will be transferred to that on the bowl. And once that happens, so I think I need to merge this person. And once that happens, the person will not be able to. The heat will be transferred to the water, all right, and it will equal almost the same kind of heat in the hand and the water. So it is advisable to run a clean water on the surface so that the heat will be reduced. So that is basically it, even for injury, so that the blood would not be on the bowl of water. All right. So it's just for you to just flush it out. All right. Um, I think I said I'll just talk to one last thing, which is seizure, because I think something we need to know. Why the rest things, something we can learn later on for ourselves. All right. Let me share my screen again. Okay, seizures. Seizure occurs as a result of disruption of normal. Okay, I just want you to pick in every word that I'm saying, pick out every word that I'm saying. All right. Seizures occurs as a result of disruption of normal electrical activity in the brain, causing an electrical storm within the brain, which result in physical changes. Convulsion can occur in sick febrile children. It is not communicable disease. All right. So first of all, they are letting us know that seizures occurs as a result of a disruption of normal electrical activities in the brain. So it is actually something that is coming from the brain. All right. So it is different from epilepsy. All right. So though everybody, how am I going to put it? Everybody, an epileptic patient, all epileptic patients will experience seizures, but not all seizures patients are epileptics. All right. Some of them are just experiencing it as a result of maybe what they are allergic to, fear, chemicals, drugs, food. Some people are just reacting to such things, but that does not mean they are epileptic. All right. So, like I said, all epileptic patients usually will experience seizures, but not everybody that experiences seizures are epileptic, and this is not communicable. All right. So, if somebody is actually convulsing, even epileptic patient, it is also an abnormal reading coming from the brain, a disruption of the electrical activities, all right, coming from the brain. So if that happens, you find out that there will be jerking. The brain will be sending a signal to the various organs of the body. The vein, the part of the body will be jerking. So if that happens, like I said, you can read the slide, it is not communicable. What you need to do, don't try to hold the person in one place. Don't try to force in things into the person's mouth. Don't try to restrict the person from checking around. What you need to do is just to control your immediate environment, control the immediate environment of the person. Thereby, if you have a soft cloth, a pillow, or anything that you can use, just put it so the person will not hit his head, or so the person will not cause more harm than good. It's because he will be checking and he can hit his head and fracture any part or fracture his skull and all of that. So you don't want that to happen. Try as much as possible to put a soft lining, a soft cloth under the person's head so that when they are checking, they will be able to, survive that situation. All right. So that is basically it for um seizures. All right. So it's not communicable. It's not something you should be scared of. It's just something you should do by just bringing soft pillow, clothes, a blanket, just place it so that they will not, injure their delicate parts. All right. So that is basically it about choking. Like I said, I don't think I'll be talking about snake bites because of time. So do you have any question as regard all of this? You have a question, or should I ask my own question? Do you have a question? Okay, in the absence of no question, I'm going to ask the question. All right, so I hope I get an answer from any of us. My question is, how do you do CPR? Do I mention it, but I'm asking it. For those of us that are teachers, it happens all the time that a teacher will give you a simple example and will set a harder question for you, maybe a test or something like that exam for you to answer. So how do you do CPR on a pregnant lady? You're pregnant, you're heavy. So how do you do CPR for them? Anybody can try. There's no harm in trying, but it's something I think we should know. So who is ready to try? It's as if I should keep my answer because nobody wants to try. Okay, let me just give the answer because of time. Okay, for a pregnant lady, especially those that are heavily pregnant, what you should do, you cannot just be compressing them there on the tummy, and especially if they are lying face up and they're unconscious. Our organs, their uterus will be on top of their blood vessels, thereby preventing blood from flowing to the various organs of the body. Remember, I said shortage of oxygenated blood going to the brain within the space of 5, 6, 7 minutes, some of the brain cells will start dying. 10 minutes and above, some of those dead cells become irreversible. All right. So their uterus will be on their blood vessels, taking blood to the various organs of the body, especially to the brain. All right. Or restricting the amount of blood that will be flowing to the various organs of the body. So this time around, you cannot do it on your own. If you have somebody there, what you need to do is to shift the uterus. I can't do it because I'm not pregnant. Okay, you shift the uterus. If you have somebody there, you move the uterus, the belly, as if you want to shift the belly to one side, to the left, not to the right. Shift the uterus to the left side of the lady. All right. Once you shift the uterus to the left side of the body, then the other person can initiate the CPR. So that is basically it, how to initiate CPR for a pregnant lady. All right. So thank you so very much. Um, so do we have a question as regard this training? Okay, without wasting much time, in the absence of any other question, I just want to introduce something to you. It is called Miss Sarah. This is a book. We're also selling, actually we're selling this anyway, for children, because it is actually a comic first aid book for children to learn, to know. See, it's an interesting one because we don't want our children to be left out. In all, maybe in every simple emergency, all right, the children should also know what to do to help manage emergency. This is actually for students, schools, preschool, and all of that. Something they can easily relate with because it's like a cartoon. So it's something they can easily relate with. We have different series. This is actually first aid for bleeding. We have the one for how to administer CPR. So it's something that will encourage us to also get for our children. If you're in a school, you can also get it for your school. We like to even have it for us to even have it maybe in our school curriculum when they are teaching the children, something I think everybody should have and everybody should know, so that whenever there's an emergency, everybody knows what to do. Okay, lastly, um I explained something about our app. We have two apps, the first responder app and the user app. The responder app is meant for those we have trained, those that want to be part of our network. We incorporate them to the responder app, while the user app is meant for the general public. So when there happen to be an emergency, all right, that is why we go out to schools, estates, paramedics. We train both the paramedics, the military, and all of that. So we incorporate some people on the responder app. So whenever there's an emergency around their location and there's a request for help, the app automatically assign them to the closest first responder that will help manage the emergency. All right. So that is it about the responder app. While the user app is open to the general public, anybody can have the user app. All right. Whenever there's an emergency, you request, the closest rider will be assigned to pick you up. So I advise each and every one of us to download this app and also help save life. All right. So it is actually called the Tcera app. Tcera. Tcera. All right. Tcera app. It stands for T stands for trauma, C stands for care, T stands for trauma, C stands for care, E stands for emergency, R stands for response, while A stands for application, which is the app. So if you go to your Play Store or Apple App Store, you're going to get the app there. You can learn first it on the app. Like what I've said, these things that I've trained you on, train about, you can go there to learn it better, because this time around you create time for yourself, learn it better gradually. All right. So once you go to the Tcera app, you're able to learn the first aid, and get more topics there on the app. You can also request for help on the app. We also have a network of voluntary blood donations. All right. So whenever there's a need for blood, you can also request for help for blood on our app. We have a network, like I said, we have people that are donating to us. All right. So you can also join our network of blood donors. All right. Because we are about saving lives. That's all TCIF is about. All right. So whenever there's an emergency, once you request for, as long as you're a part of our network and you're a part of our blood donation team, whenever there's a need for blood, you are sure to get it, all right, for free or at a subsidized rate, because you're a blood donor with us. And you can also schedule your blood donation appointment also on our app. All right. So it's as simple as that. All right. So you can request for blood, you can schedule your blood donation on the app, you can learn first aid on the app, and all of that. So thank you so very much for connecting for in today's training. So if you like to be part of our network, I would like to call my number out. Also, you can actually send me a text, or is my WhatsApp number. You can send me a message on the WhatsApp. Then we can reach out and talk better on how you can be. We also have this thing that we are giving out. Certificate. If you want to get certificates for this training and all of that, then as well give it out to you. So I'll call my number right now. So if you want to download the app, you're having any difficulties, also just let me know. I'll just send you the link to the app so that you can just click and download it directly and take the course, the full course on the app. All right. So 090. So I'm calling my number out, my WhatsApp number. So if you have schools that you want to train, we also offer free training. Lest I forget, we offer free trainings. If you have schools, organization, churches, anywhere you want to train, you can also invite us to come to train. But if you're coming over, you have to take over our logistic fee. But if you want to come to our facility, because we have facility that you can come and we do the training, it is actually for free. You can come over to our facility, we training for free. But if you want to bring us to your location or your facility, then we advise maybe you take over our logistic fee. Okay, 090 52 56 5689. So that is it. I repeat again, 090 52 56 5689. 090 52 56 5689. So thank you all once again for connecting. If you have a question, just send it to me on WhatsApp. I'll be able to answer you there. Thank you. Really appreciate your effort. I will encourage you all to be a first responder with our network, because you will help save life in your location. Imagine if an emergency should happen around you and you know what to do. You are a hero for that day. All right. Thank you so very much for connecting. Do have a lovely day.
Hi, sir.
Oh, all right.
Okay, so here's what to find out. This is basically in just Nigeria, right?
The app does not function just in Nigeria. All of like I said earlier on, we are expanding to